Hi, my name is Jody Noor. I am going to tell you all a little bit about my graduate project for my MSN in nursing education. And I did my project as a teaching a unit on urinary skills. So let's get started. My graduate project was taught to BSN students. They were in their fundamental skills class at South University. My preceptor works as the clinical coordinator for South University here in Columbia, South Carolina. Their students' rotation is not the same as ours, and so I was able to have the same students for my entire project, which was great. The students were in that fundamental skills class where they learned how to place and use an NG tube, how to place and care for a urinary catheter, basic care like dentures, making a bed, tracheostomy care, your typical skills class, pretty similar to actually what we teach in the ADN or in the PN program. So starting this project, I did a needs assessment. I interviewed my preceptor, I interviewed the other faculty that worked with us, and I interviewed the students. So I discussed with my preceptor which area covered in the BSN skills class was an area that she felt like the students could need help with possibly. She gave me a couple of options, but felt that there were 2 weeks that were more difficult for the students in most of the terms. One of those was the urinary system and the other was the respiratory system. And so I went to the students and the other faculty and asked where they thought that they might need extra help. During the interviews with students, I asked about which sections of the class had them worried. The questions included things like, are there any units in the syllabus you're worried about? And have you heard from previous students that one unit is harder than others? And the majority of the students actually chose the urinary system. And I was a little bit surprised by that because I thought that maybe the respiratory would be harder. But the students had heard from previous students that it was a very hard week and one that most of the class had struggled with in the past. So the final decision was the urinary system. My preceptor agreed to let me teach the genitourinary lesson and record it for her class. I started my research by asking the students to take an online survey. I wanted to assess their learning styles. After having the students do this online survey with the Pennsylvania Higher Education Assistance Agency, the majority of the students were visual learners. Due to that fact, I chose to not only lecture on the subject for the auditory learners, but also to make a handout for the students on important facts about the GU system that would help them have something to look back on and help them with their studies. I also, for the kinesthetic learners, I showed equipment and let them kind of pass it around and touch it and get a feel for it so that they could have some good experience also. So I started my research on the genitourinary system using CINAHL. My search words included urinary retention, nursing assessment, urinary tract infection, preventing catheter complications. I also used CAUTI and a few more. I limited my search to data that was less than 10 years old and that had full documents and written in English. So using those, I summarized the main issues of the GU system. I then went back to their lesson plan to make sure that I was meeting the students' course objectives. I obtained their course textbook and to make sure that they're teaching, what I was teaching was in line with what they were learning in the didactic portion of their course. So I used the text as the basic teaching assessment, as the basis for teaching the assessment of the system, so what they were reading was reinforced verbally. Once I reviewed that literature, I started to build a lesson plan. The research actually took a lot longer than I thought it was gonna, and finding information that I needed, making sure it was the most current, along with making sure it was meeting the objectives of the course was a huge undertaking. Writing the actual lesson plan also took much longer than I thought it was going to. It was only the second lesson plan I had written. I'm really still not really comfortable with them, and I made it really detailed, so it took a long time. So the delivery of the lesson I really thought was going to be the easiest part because I teach every day, and I've taught skills class before. That morning was a rough one. I was supposed to teach. I was nervous, which is odd, and I left home early. I got up early. I left early because I wanted to be there in time and have time to set things up. But there was an accident on the interstate. The campus is 50 minutes away from my house anyhow, and so thanks to that accident, instead of arriving early, I barely arrived on time. I couldn't find my preceptor. She wasn't answering her phone. I didn't see anyone except for one of the other instructors, so she helped me actually set the lab up. We got all the equipment out, had anything ready to show the students, and 30 minutes had gone by and we still hadn't seen my preceptor. We hadn't seen any students, and we kind of were thinking, well, where is everyone? And realized they were probably taking a quiz. Quite often they would have quizzes before their lab, and my preceptor was not always great at giving me a heads up about that. And I didn't want to walk downstairs and interrupt them in the middle of their quiz, so we just waited in the lab for them to come. Unfortunately, when they did come, my preceptor had taught half of the lesson downstairs. They got going on the subject, and anyway, she had taught about half of it. So, we kind of brainstormed. We figured out what still needed to be taught, and decided I would teach the rest of the morning lesson. I was a little bit flustered because everything hadn't gone as planned. I'm quite particular about the way I like things to be, but I'm also a nurse, so I go with the flow. I did ask one of the students to videotape for me on my iPad. The students interacted some, not as much as I'd have liked in that morning class, but it was probably partly me being stressed. And I mean, the lesson itself went well. The other instructors kind of interjected when they wanted to, and we all worked together as a team. And it took me a little over 30 minutes to teach the rest of the lesson. The afternoon lab went much more smoothly. I asked another student to video. I taught the whole lesson. I did the urinary catheter placement demonstration. This class was much more interactive than the first, but I was more comfortable. During the afternoon lab, I ended up teaching for over an hour. We were able to make enough copies of the handout for both classes, so that was great. I was a little concerned that we wouldn't have enough copies. I used pictures on that handout of the actual equipment so that when they were going back and looking, they could see what they needed to see. I also included signs and symptoms of different issues and medications that are used to treat issues. I chose to do this because it is a skills class, and it's important as a nurse to recognize when something's happening with your patient. I also chose to record using my school iPad. I hadn't really used it at all. It had all of its memory, and I thought that would be great. Unfortunately, about 50 minutes into the afternoon lesson, the iPad's memory was full. So I have an iPhone, and so I asked the student to use my iPhone to record the rest of the lesson. And luckily, I had enough room on my iPhone to be able to do that. So there were some issues, but it did go well, as well as could be expected. For evaluation, I had 3 ways to evaluate. I did a student survey, I made a quiz for them, and I got some verbal feedback. So I taught that lesson twice. The first time, the group was about 15 students, and the afternoon session was about 9 students. I gave them that evaluation form after class and asked them to fill it out. A total of 20 evaluation forms were turned back in, so I didn't think that was too bad. 15 students rated instructor knowledge as excellent. Other results rated as excellent were printed materials that were well organized, printed materials that were related to the course, instructor stayed on subject, instructor encouraged class participation. So I think that they thought that I did well. I gave a total of 24 GU quizzes. Those included 10 questions. They were each worth 10 points to total 100. The students did well on them, and I was thankful that they did them because it really didn't count towards their grade. I had 7 students that got 100, so I thought that was really good. 3 questions asked students to list alternatives to placing an indwelling catheter. I had things on there about I gave a scenario that described functional incontinence. So I did more than just multiple choice. I don't know if they'd have done better if they were just trying to hurry because it didn't count as part of their class. But I thought overall, they did well. I got some verbal feedback from the students that was really good. I got some verbal feedback from my instructor who said I had done a very good job, that she thought I was well prepared. And the other instructors that were involved really liked the handout and asked if they could continue to use it. So, that made me happy. I felt like I could actually contribute something to their program. As for meeting my learning outcomes with this project, the learning outcomes are based on the AACN Essentials. In our student learning handbook, our MSM program handbook, there are 9 outcomes listed. I feel like I met the first outcome, which was integrate evidence-based nursing practice and related sciences for improvement of nursing care. Using evidence-based practice to write the genitourinary lesson and teaching it to those BSN students is really what this outcome is about. By passing on knowledge based on evidence to future nurses, we're improving nursing care. Acting as role models for our students by basing our teaching on best practice is one way to instill good, solid skills in our nurses. Perform as a member, educator, and leader of nursing by developing and implementing patient safety measures and quality improvement. Performing as part of the team by implementing patient safety members and quality improvement initiatives were integrated into that student's lesson plan. Quality improvement considerations in regards to CAUTI and long-term indwelling catheters was a major portion of this lesson. Implementing these quality improvement initiatives improve patient outcomes. So teaching them the way to improve those outcomes is how I met this outcome. Applying research outcomes in practice and education settings to resolve nursing practice problems and disseminate knowledge. Applying research outcomes in practice is the basis of my genitourinary lesson. Teaching the students best practice and critical thinking skills is acting as a change agent. I included what signs and symptoms of different disease processes looks like, what they should look for, and what to do about it if the patient exhibits symptoms. Demonstrate role development by performing in the role of nurse educator, leader, or advanced practitioner. I am a nurse educator major, so my project was all about teaching the students. So I taught the students using best scientific evidence to those BSN students at South University to meet this program outcome. So I hope you liked my project. It was a lot of work, a lot more than I thought it was going to be. But I believe that the students got a lot out of it. And actually, I was really impressed. I got an email about 2 weeks ago asking from a couple of those students at South asking if I would tutor them for this term they're in med-surg. So makes me feel pretty good that they really felt like I knew what I was talking about, and hopefully I made a difference, at least for this class. Thank you very much for your time. I hope you have a wonderful day.